this is a really important piece of really the recruiting process in that you're finding that there are several phases of this, as I understand it, right? There is really going to these recruits and these nursing students early in the stage and having them come on to certainly campus into the to the hospital. And then obviously to the point when they're graduating to bring them on. And I think if I'm correct, I remember you were saying that those who come earlier and get engaged earlier are more apt to retain and thrive once they come. Is that correct?
Yes, absolutely. And so, such a great point for you to bring up. And so, I like to use the word that we're preserving the pipeline through this COVID epidemic. And for that reason, we were one of the few hospitals, I believe, in the country, and certainly when we benchmarked against some of our colleagues in pediatrics, that actually continued with our summer immersion program. It's called the Launch Program, and we knew that it was important for these students while they were still in their academic settings and they're still progressing towards graduation, that they still needed the clinical learning experience in the practice-based setting. Simulation, whether it's interactive e-learning or high-fidelity simulation, is great, but certainly the experience in the practice-based setting is so vital. And what we have learned from our data is that those individuals who do participate in a summer immersion program or even have nursing student roles within an organization such as a patient care tech or a safety attendant, which we have both programs here at Children's. We call our nursing students child care technicians. We also have safety attendant positions for nursing students. Any one of those roles, as well as those who participate in our summer launch program, when we looked at our data actually over 3 years, we found that the average length of employment at the 2 to 3 year mark was higher. We had less turnover with those individuals who had had previous experiences in the hospital environment, specifically our hospital environment, with previous pediatric experience and exposure. And so we believe strongly that this type of program is so essential in managing that complexity gap that there's great concern is widening during this time because of the lack of clinical learning environments and placements for these students. And so we definitely think that having those programs is important. And one really innovative and creative way that we've also managed that is this fall we launched what we call Pediatric Virtual Learning Series. And through my simulation team, what we did is we took some topics that we learned from our students over the summer based off of their feedback that was important to them about, the principles of documentation and managing early escalation and code response. And so we actually offered a 4-part series this fall for our nursing students and faculty. We had over 70 students participate and 6 faculty in these 1-hour simulations with debriefs and pre-learning. And resoundingly, the response was so positive that we're actually preparing our next series for the spring as well. And we'll make these available to the schools, not only for future semesters and for future students, because we really do think this disruption in learning and the education framework, I think it's just opening up new innovative and creative ways for academic practice partnerships as well to make sure that we do meet the needs of the students as they progress and then transition into practice.